Can you guys hear me okay? I'm trying the headset without the microphone. Okay, perfect. All right. Welcome to week 2 of HIT 500 Health Statistics. We are going to, of course, go over our math trivia. We have our knowledge check quiz, highly missed questions that I'm going to go over, and you guys will be very impressed. There were only a couple that we're going to cover. We have a chapter 3 where we're going to break down patient census. Now, every Friday, as you know, I'm going to give you guys some of your plan reflections kind of broken down, but that doesn't mean that if something else comes up and you're like, I still don't get it, let me know. We found a discrepancy, or not we, but one of your classmates found a discrepancy. Thank you, Miss Janet. And I was able to correct it. So some of you may have slipped through, and when you see the question, you'll know what I mean. If you do get it, do not stress, you'll get extra credit. It'll make sense if you get that particular question, okay? It's mathematically impossible to answer, and you'll know why if you get the question. All right, so just know that it has been corrected, but if for some reason you get it, don't stress. Continue to work on your knowledge checks, you guys. I will be trying to go and check to make sure everyone has done them by Thursday. Granted, that's not the requirement. I just want to see where you're at, to give you some kind of like inspiration to keep you going, okay? Once we're done with all that, we're going to wrap everything up. Now, for those of you who are watching the playback, this discussion form question is a little bit different. We're talking about numbers, right, in health statistics. So for this week, I would like you to find the #1 box office movie that was playing the year you were born. Now, do not give the year. Keep in mind, do not give the year, but you're going to give the movie and we'll kind of guess it. So I'm going to start with mine. It was Greece. It opened up with 181,813,770. Again, do not place your year, but find the movie and how much it opened up with. And let's talk about what movies were playing the year we were born. All right. Now, what number doesn't have its own Roman numeral? And I found this one kind of interesting. Like, you think about it and you're like, oh, yeah, that's right. It is the number 0. And how many times has this happened to anyone? And I'm already raising my hand. That awkward moment when you finish a math problem and you're like, yes, I got it. And you go to check it and your answer isn't even one of the choices. And I like math, and that has happened to me plenty of times. Okay, so now let's get into the highly missed questions. All right. Now, starting right off of the bat, okay, data that is able to be replicated by another researcher is said to be, it's just reliable. Okay, we know that we can use it again. We know that it has been tested for whatever reason. So, ah, great minds. Um, we know that it is able to be spread on. So reliable, okay? Replicated, reliable, just in case you see that question again. This next one, blank data sources are derived from blank data sources. Your secondary data sources are going to be derived from your primary data sources. What does that mean? So your primary data source would be like your patient's records, right? Your secondary data source could be an interview from an online survey. Um, your patient record is right there, observation, you're seeing what's going on. Your survey, you're not really there with the patient, you're kind of getting secondhand, so you're not really physically seeing it. So if you see this question again, secondary data sources are derived from primary data sources, okay? Which of the following is an example of unstructured data? Now here, think back to what unstructured data is. We're talking about being able to just voice to talk, maybe like an email, a text message where you're actually typing in different things. It doesn't have a template. So if you look at the other things, patient's age, that could be templated. Discharge date, that could be templated. Even systolic blood pressure, okay? But your progress notes is going to be freehand usually, where you can just go in there and type whatever your heart desires. You may even be able to add imagery, x-rays, etc. Okay. The last question, yes, you heard that correctly. The last question from the quiz. All right, so this one I kind of broke down. All right, now a group of 106 children. They're seen at the hematology specialty clinic in 1 week. 36 have classic hemophilia type A. 70 have just other bleeding or blood disorders. What is the proportion of people in the group that have classic hemophilia type A expressed in a decimal and round to 2 decimal places? Okay, so this is a little different from last week, where last week we were just kind of giving information and breaking down primary math. From here to week 8, because 9 and 10 you kind of get a break, we're going to be really calculating really word problems, okay? And breaking them down. All right, so these are your choices that you had: 0.34, 33.96, 3.39, and 0.33. I'm going to break it down for us. There were 106 children seen at the hematology clinic. Okay, we got that. 36 have the classic hemophilia type A. All right, we got that. Here is extra information. That's why it's not highlighted. This is cool. That's good. But for this particular problem, we're not going to do anything with that number. Okay. What we're going to do is we're going to take the 36 classic hemophilia divided by 106, because those are the total number of children. That gives us 0.33 blah, blah, blah. Okay. Now, the biggest thing is we're expressing in a decimal and rounding to 2 decimal places. So we know that 0.339, and here's that basic math coming in where we have to round, all right? Yes, exactly, 0.34, okay? And so I broke that one down because that was a highly missed, and it wasn't just your class. I've been grabbing highly missed questions that have been going through, and this is one that has actually been going around, and so I want to make sure that we're breaking these down. And so when we get problems like this in our quizzes and our knowledge checks, I'm going to break them down. Okay, so don't stress. And I say that because there may be questions that is not highly missed, but you still want to know how to get to it. Send it to me. I'll break it down for you specifically, and then I'll come back for the next live session and break it down for the rest of the class. Okay, now for our knowledge checks. There were only 2 questions from the knowledge check. So you guys, good job. Very first question in front of you. Data collected in response to the following prompt would be characterized as what type of data? Please list any suggestions for improvement in your experience as a patient in our facility. You have statistical methods that are used to find patterns, and data are characterized as qualitative. Okay, qualitative. Next and last question. Relative value units are used to determine payment for physician services. Again, to determine payment for physician services. So 6 questions between both the quiz and the knowledge check, week 2. I think we're doing pretty good. All right. Now, like I mentioned, we're getting to the meat and potatoes of our course. From weeks 2 through 8, we're going to be doing a lot of formulas. We're going to be looking at a lot of different ways that we calculate statistics. A lot of facilities, they want particular statistics. You may have one facility that does it one way, and you're going to learn both formulas in this class. But this week, we're just talking about patients. What is census data in healthcare? All right, so health statistics are really important because we're measuring how we're doing overall as a nation. The Census Bureau provides accurate detailed and up-to-date statistics that cover people as well as businesses, and this is all relating to health in America. Let's recap. Let's see if you remember these two from our highly missed questions. And if you notice, I'm grabbing them because I have seen them quite often. Data that is able to be replicated by another researcher is said to be. Remember that word replicated. We can use it over and over again. That means that we have trust in it. We know that the information is about to give the word, think of a different other word for it. Not corruptible. Is that a word? I don't know. It's reliable. Okay. And then this next one. Blank data sources are derived from blank data sources. Guys, remember, we're looking at secondary and then primary, okay? Now, getting into the census, we're looking at calculations, all right? We're going to be calculating inpatient admissions, inpatient census, complete master census. We're going to be doing admissions and discharges, or what we normally say A&D. We're going to be looking at the difference between an interhospital or interfacility, where we're moving from just one department to another department, to intrahospital transfers. We have to calculate the daily census and inpatient service days using just the admission and the discharge days that we have been given. And then we have to calculate the census and inpatient service days with data given from newborns and transfers. One thing that you'll notice in statistics is that newborns are calculated separately from adults and children. Okay? Again, newborns are calculated separately from adults and children. Now, the inpatient census taking time is usually at midnight. Okay, so when we're taking the census, it's usually at midnight. But don't get caught up on that because that answer will come up. It can occur at any time as long as the time is adhered to consistently for the entire facility. I have seen this question again. So inpatient census time is taken consistently at a certain time. It's usually at midnight, but not every facility is open at midnight. You have some same-day surgeries. So they're not open at midnight. So they can't take it at midnight, right? Where they want to know how many patients they have in-house at a particular time. So consistently at the same time. Daily inpatient census is the number of inpatients that are present when they're taking that census each day, plus any inpatients who were both admitted, so they came in after the previous census. So let's say they've taken census, this is a big facility, all right? They've taken the census at, let's say, the midnight, but then 2 patients from the ED were admitted up into their ward at 2 a.m. They're now going to be included in the next day census, all right? But we look at the previous census taking time and discharge before the next census taking time. So in that same period, a patient who was discharged before the next census, so you have to look at all of that. But don't worry, we're going to calculate it. We're going to get into it. Right now, we're just going over the terms, okay? So in this particular class, they will throw you a lot of different terms and then come back and ask you to calculate it, okay? You see in front of you that each PCU also reports the numbers of their patients that have come in, that were admitted, that were discharged, right? These are commonly called your ADT system. For those of you who have been in the healthcare system for a while, you know that's admission, discharge, and transfers, right? You see in front of you how the information is combined. We're getting all this information from the entire facility and adding it up for the higher ups that want to know. We look at our daily inpatients. Now, the daily inpatient census is just a statistics. It measures the number of patients admitted to the hospital or unit at any time during the day, okay? For example, a patient comes into the ICU and that patient could be admitted at 8 a.m. We have a huge volume of services and the staff time before they pass away, okay, unfortunately. So you're looking at all of the moving parts as we are getting these done. Now, don't get that confused with your daily or your inpatient service days. One unit of one service day is not usually divided or reported as a fraction of the day. There's no fraction of a day, you guys. The day of admission is counted as an inpatient service day, but the day of discharge is not. And this is going to be really important as you're calculating, okay? So for inpatient service days, admission counts, discharge does not. No patient admitted to an inpatient unit can have a 0 service day. So even if they came in on, what's today, October 10th, and they were discharged on October 10th, they're going to have 1 day, okay? They can't have 0. That's basically all that's saying. So different names for inpatient service day you may hear depending on where you're located, where you're going. You may hear patient day, you may hear inpatient day, you may hear bed occupancy day, or they may just simply call it census day. Okay, so again, that just depends on where you're going to be. All right, so you have your total inpatient service days. The term total inpatient service days is just talking about every day that the patient was there for a particular time period. So in front of you, you see the example, June 1st, 2nd, and 3rd, right? And you are, let's say they just want those 3 days. They don't want the rest of them. They just want, what were the days from June 1st to June 3rd? Well, then you would calculate it. But for the total service days, you're going to calculate from June 1st to, in this example, June 10th, giving you 770 or 707 days. All right. So I'll leave that up for a little bit so you guys can see. All right. So we're calculating inpatient service days. Now this includes inpatients admitted and discharged on the same day because inpatient service days. Day of admission is counted as an inpatient service day. Again, day of discharge is not. The usual reporting period, you guys remember, we're looking at midnight. One inpatient day must be counted for each inpatient admitted and discharged on the same day between two successive census taking hours. So this is just an example of an inpatient service day, like how they would display it. All right. You're not going to have to calculate anything like this, but they just want you to be able to see it if for some reason you go to a facility and they're like, this is how we do ours. We look at transfers. Intra-facility, you see I highlighted it, okay? Transfers in and out of any specific medical care unit may or may not be equal. It could go from the ED to ICU, ICU to step down, okay? But they must be equal for the overall hospital capitalization. Every patient transferred into a unit or any given day, they have to be transferred out of another unit, okay? So it may involve transferring a patient from, let's say, X-ray, and then transferring them to another facility with more advanced care. Like they can't take care of them here, so they got to send them where they will get the best care possible. Transfers in and out of hospital, called interhospital or interfacility, are included in admission and discharges. You may see that question again, so I will repeat. Transfers in and out of the hospital are included in admission and discharges, sometimes called interhospital or interfacility transfers. Transfers in and out of any specific medical care unit may or may not be equal, but they must be equal for the overall hospital summary. So every patient transferred into a unit on any given day must have been transferred out of another unit. They can't just pop out from space and be like, I'm here, right? Every patient transfer into a unit at any given day must not have been transferred out of another unit. So I'm repeating that. Failure of these data to balance may mean that a unit neglected to report transfers correctly. So that's why we're really hyping or honing into attention to detail when we're doing these calculations. Patients admitted and discharged on the same day, in and outs, A&Ds counted in inpatient service days, but not counted in inpatient census. So when a patient is admitted to inpatient hospital care for a minimum of 8 hours, but less than 24 hours, and discharged on the same calendar day, the physician shall report the observation or inpatient hospital care services. Okay, so that's how they're saying it. I will repeat. It's from 8, we call it 2359 for those who've been in the hospital for a while. So you have minimum of 8, less than 24, so usually 2359. They are going to be reported as observations or inpatient hospital care services. Okay. Now, the average daily census is the average or mean number of inpatients present in the hospital each day for a given period of time. If a hospital had 6,653 inpatient service days for adults and children and 155 inpatient service days for newborns for the month of May, what was the average daily inpatient census in May, rounding to the nearest whole number? So I went ahead and put it up here. Remember, adults and children are calculated separately from newborns unless otherwise directed by the hospital's administration. So here, breaking it down, 6,653 inpatient service days divided by 31. What is 31? There's 31 days in May. So then you have the 214.61 rounded to 215 patients. Okay. Remember that we talk about newborns. So the total number of patients admitted and born during the month of a year is added. So you have the patients remaining census with which the month of the year began. So you have the sum, the number of discharges during the month or year is then subtracted. Okay, now this very next slide, I'm going to leave up for you. You're going to get this today. This is your formula review. So you can screenshot it, but I am going to be placing this into your announcements so that you have this. Okay. I got to try to remember. Can someone send me a reminder to get your formulas to you around the same time I upload your apply and reflections for the next week? So someone just remind me on Friday, hey, don't forget the formula review so that I can have that up there for you guys as well as a quick reference. Okay. Now, in front of you, you just have your formula. So you have your average daily inpatient census, where you take the total number of inpatient service days for a given period divided by the total number of days for the same period, as well as your average daily inpatient census for newborns, because remember, they're done separately, and then your average daily inpatient census for a PCU. All right, so what we're going to do right now, 2 more questions, and then you have some poll questions that you guys are going to work on. But do not stress because I am going to break them down once you guys go over them. You're just going to give it your best try. So these very first 2 questions, to sit back, relax, because these are really good recaps. The time for taking the inpatient census must always be, and remember I was telling you that you will see this. So you'll get 11:59 a.m., you'll get 12 p.m., you'll get variable, or you'll get consistent. I pulled this up because I have seen it. Your answer is consistent. We do know that the majority are taken at midnight, right? But again, there's a lot of facilities that aren't even open. So the time just must be consistent. Okay. Now, here's another one. We're doing this one together. Metro Hospital has 30 bassinet nursery. They have a total of 729 newborn service days for the month of May? What is the average daily census for May? May has 31 days. Round to the nearest whole number. All right, so your options: 22, 23, 21, 24. Remember, this is a recap, so I'm going over this with you guys. Again, remember that the month of May has 31 days. So for this particular question, you take the 729 newborn service days, you divide that by 31. Hopefully someone has your calculator out, because if you divide 729 by 31, you should get the answer 24. All right. Again, time for taking inpatient census must always be consistent. Again, we know that it's normally at midnight, but not every facility is open at midnight. All right. Here's where I turn it over to you, where you get to practice. There are only 4 questions, and only 2 are mathematical, where you have to figure them out. One's matching, and then the other one is a true or false. Okay, so I kind of like wanted to spread it so you can kind of see all the possible questions that you may get. I'll also give you another hint. You will see these in your apply and reflection. So we are working them out together, and these are different from the apply and reflections that I covered. Okay. Now let me go ahead and start the poll. Again, these are only 4 questions. Okay. Give it your best try. And then after, I'm gonna give you guys about 5 minutes. So a minute and a half, or a minute and 15 seconds a question, or a minute and 25 seconds a question. And then we're gonna come back, and then I'm gonna go over them. For you guys that are watching at home, don't stress at all. I have put it on the next couple slides so that you will definitely be able to follow along with us, okay? So I'll give you guys 5 minutes, take your time, don't stress, and then we'll come back and work these out together. All right, so we're getting ready to go over these questions. Going to go in the poll and share the results with you guys. So those who have taken it, you guys will be able to see the results. Now, like I mentioned, I like to break things down. Okay, I'm a very visual person. So for this very first question, okay, in 2000, let's say 2023, a hospital had 175 bed for adults and children from January 1st through June 30th. On July 1st, the hospital increased its beds to 250, and the number remained at 250 through December 31st. Now, during the first 6 months, there were 30,875 patient days for service were provided to the hospital's adults and children. During the past 6 months, 36,982 days of service were provided. Answer the following questions and round the answers. Yes, that is correct. 186. How did I get it? Well, this was a two-parter. We have to first add the 30,875, as you see that I did here, to the 36 1,982. No worries, but you're able to see it here. I love it. Good job. And then you divide, you get that 185, blah, blah, blah. But those keywords, right? Rounding to the nearest whole number lets us know that we have to go to 186. So good job. The next one, so that's why I said I broke it down, because you will see these questions again. So the next one. Here you have Community Hospital reported the following for the month of July 2023 again. And we are going to calculate the average daily inpatient census for adults and children, rounding your answer to the whole number. And again, you see how I broke it down right here. Keep in mind that when you're calculating the average daily inpatient census, you need to know how many days there are in each month, right? So we are looking, we see that we're talking about 3,198 inpatient service days divided by 31, okay? Giving us 103.16. Again, they want us to calculate that whole number. So then your answer is 103, okay? The next question was just matching, all right? So the terms that you were given were average daily inpatient census, daily inpatient census, inpatient census, and patient day. And I break those down because, or I grab those particular questions because the names kind of sound similar. So I want you guys to just go back and really make sure you understand the differences, because it's small, finite, um, like small stuff that kind of like, okay, well, this is definitely average daily inpatient census versus inpatient census versus patient day. And they'll throw a lot of different variations of questions where you have to figure out, okay, which one is this? And then there is one in your apply reflection where you're just matching, which makes it a little bit easier. But moving forward, you may see them thrown out because they do bring back repeat questions from previous weeks. Okay. And then the very last question, the formula for calculating the average daily inpatient census for a care unit is the same used in the overall average daily inpatient census, and that is true. Okay. Now, what you'll notice is that our sessions aren't that long, but we are going to be having, you guys will have a lot of ancillary um, information, so that at the end of the live session, if there are any questions with anything, make sure you grab them, okay? Grab me so that I can, you know, work it out together as a team, because we are all in this together. Y'all are not by yourselves, okay? We did go over the math trivia. What number doesn't have its own Roman numeral? That is 0. Remember that you guys can do anything once you have gotten comfortable when it comes to math. All right. For those of you who are watching the playback, remember that we're talking about numbers this entire module. And this week we're going to find that number one box office movie. Just found out that me and another individual were born the same year, right? Greece was mine. It opened up at 181,813,770,000. When you guys are doing it, remember, don't place your year. That's the fun part. We got to figure it out. But put the movie and how much it opened up with. We did go over your highly missed questions. This week was patient census and we wrapped it up. Next week is very unique. Okay. So I want to remind you that career services will be here, but I am still providing you with your highly missed questions uh, during or actually before the career services comes. I'll usually come in like 15 minutes earlier, pre-record that so that when they come, they can do their thing, and I'll timestamp just the missed questions so you can go back at any time and see those. I will be doing your apply and reflection review prior. I will try to remember to get this formula as well so you have both the apply and reflection and your formula together. And if there are any questions, especially because we aren't going to meet, like we'll meet, but it's really career services, y'all please reach out. Usually week 3 becomes a little bit tougher because we aren't like here and I'm not physically there to kind of break it down, but I'm going to try to do a really great job making sure that the review for the apply and reflection is really, really in depth. But again, if there's something that I missed or something that I didn't touch on, let me know, okay? Because I really want to make sure you guys are comfortable, and especially as we start to get ready to get into the midterm, okay? So what questions do you all have for me this evening? If any questions at all. No questions? I don't see anything coming up. None? Okay. All right. So on that note, you guys have a wonderful rest of your evening. Have a wonderful week. Remember, we're talking about resumes Monday. Usually they ask you guys to get your resumes ready, so start working on them and have them ready because Melissa's going to ask you to submit your resume to her. Even if you don't really think you have anything, get your resume ready. I have it for her on Tuesday. We'll meet on Tuesday. On that note, you guys be safe. Have a wonderful rest of your week, wonderful weekend, and I will see everyone who can attend in next week Career Services live session. Good night, everybody.